Hi, come in.
Okay. Hi, I'm Brittany. I'm your student nurse today from Chamberlain. I'll be doing a head to toe assessment. It'll take about 15 minutes. Is that okay if I get started?
Yep, that's fine.
Perfect. I'm gonna check your band. What's your name and date of birth?
Rosa Romero, 6/11/96.
Perfect. And then what is the date today?
December 3rd, 2018.
Perfect. And do you have any allergies to latex, medications, environmental?
None.
None. Okay. And are you in any pain right now?
No pain.
Okay, perfect. So her LOC is ×4. She is sitting upright. When I'm looking at her right now, no physical deformities. She's in no signs of distress as of right now, and she's dressed appropriately for the weather and the situation. Next, I'm going to do vital signs. I will do her blood pressure. It would be 120/80 within normal limits. Her heart rate is anything between 60 and 100. Her respirations are between 12 to 20 in normal, and then her oxygen pulse ox would be 96 to 100%. So I completed vital signs. Then I'm going to start with assessing her skin. Just looking at her right now, there's no lesions. She has no wounds. Her skin color is even distribution. Then I'm going to be looking at her cap refill, so I'll look at her hands. She has no clubbing, is what I would look at first, and then I'll do cap refill after that. Okay, so less than 3 seconds, perfect. When I touched her skin, it was warm and dry, and then, like I said, she has no clubbing. So then I'm going to move up to her head. I'm going to just feel if there's any lesions or bumps. I'm noticing it's normal cephalic and no lesions or bumps. I'll assess her face, making sure it's symmetric. There's no drooping or anything like that. Next, I will move to her eyes. So can you take your glasses off for me? Perfect, thanks. And then just stare straight ahead for me. Perfect. Awesome. And then follow the light towards you. Perfect. So her pupils are equal, round and reactive to light, and she accommodates to the pen light. And I also noticed that she is wearing glasses. So then next I will move to her nose. I'm looking at it and it's midline. There's no bumps if I'm looking on this side of it. It's symmetrical and midline. Can you go like this for me? Hold one nose and then breathe in. Perfect. And then do it the other side. Perfect. And any trouble on either side?
No.
No. Perfect. And then I'm looking at her nose and seeing if there's any drainage. I'll kind of look up it as well. No drainage noted. Next I will move to her ears. I'm looking to see if they're symmetric to her face. Do you have any pain when I push here?
No.
And what about here?
No.
No. So she has no pain when I push on her both sides of her ears, her tragus. And then she has no drainage noted, no crusting on either side of the ears. So then next I will move to her mouth. I'm looking at her right now and there's no cracking or lesions on the lips. Then can you open up for me and say ah? Perfect. So her uvula raises and it's midline, and then she has pink, moist oral mucosa. So then next I'll move and I'll listen to your respiratory system and your cardiovascular. First we'll do respiratory, your lung sounds. So take a deep breath for me. Perfect. One more. Perfect. One more. And again. One more. Again. So that was anterior, and then I'll move to posterior. Take a deep breath. Perfect. One more. And again. One more time. And again. And then again. Perfect. So listening to her, she's clear, unlabored. She's not using any accessory muscles. So then I will move to her cardiovascular. So first I'll start with palpating her carotid one at a time. Perfect. And then I'll listen to see if there's any bruise. I'll be using the bell side of my stethoscope. And then hold your breath for me. Perfect. And then relax. Hold your breath for me one more time. Okay, and relax. Perfect. So there was no swishing noted, S1 and S2 heard. So then next I'll listen to the 5 heart sound listening points. So then I'll start with aortic, pulmonic, herbs, tricuspid, and then mitral, which is the apical, and then I will listen for 1 minute. That's in with normal limits. It's 74 is her apical pulse. So then I will move on to GI. So then I'll do her abdomen. I'll assess her abdomen. Can you lay down for me? Perfect. Okay, so I'm first looking at her abdomen. I'm noticing that it's flat, contoured, soft. Then I'm going to listen for bell sounds. I'll start in the right lower quadrant. Then I'll move upward to the right upper. And the left upper. And then the left lower. Okay, so bell sounds heard in all 4 quadrants. Then I will palpate. Let me know if you have any pain when I do this. I'll use circular motions. Any pain?
No.
Okay, perfect. So then you can sit up for me. Okay, so then I saw her when she walked in that her mobility and gait was well. She's not using any assistive devices. It's smooth and even. And then I'm gonna do your muscle strength. So then can you put your arms up like this and then pull up against me? Perfect. And then do it again. Push. Okay. And then pull back towards you. Push and then push towards me. Perfect. Okay. So then her muscle strength is 5 plus. And then I'll do your assess her dorsalis pedis pulse. So I'll feel for her here. Perfect. One more. Perfect. Okay. So that concludes my assessment. Is there anything I can get you before I step out?